Mental health is an issue that affects the entire country. A large portion of the numbers of people with mental illness come from colleges and university students. 44%, sorry, I can't read without my glasses, just want to make that known. 44% of all college students suffer from some form of mental illness before the age of 24. 30% of all female NCAA athletes will suffer from mental illness during their time at whatever college and university they're at, while only 25% of male NCAA athletes will suffer from a mental illness. This is a map that I Googled just for the photo purposes, but I took time to research some of the policies and procedures that several schools across the country had available to help for mental health in student athletes. And what I found is that almost all of these schools recommended that the athlete go straight to their athletic trainer for help regarding mental health issues, that the athletic trainer was their first point of contact. 10% of those students from the previous percentages reached out to their athletic trainer in regards to their mental health problems. Only 10. So, what happens when they go see the athletic trainer? They'll go in, and normally the athletic trainer will sit and talk. They'll go over how they're feeling, what they were feeling, when it started, how long ago did it start. I think I just said that twice. How they're feeling today. What affects their mood, what makes their mood better, how their family life is. Basically take an entire history of nothing but mental health with this athlete. But 9 times out of 10, the athletic trainer is going to refer the athlete to a psychiatrist, to the school counselor, because I'm pretty sure that most colleges have free school counselors for anybody to go talk to. But with that being said, a counselor is somebody normally that a student athlete is not familiar with. Most of the time, athletes aren't even familiar with them unless maybe they're a psychology major. I think that's who does counseling. That's normally the only people that know who this person is, unless they're other faculty and staff. Because typically, an athlete doesn't have time to go out and get to know the other faculty. Well, if an athlete is suffering with this problem of mental health and they're going out and they brought forth to you that they need help, and that's a big step. It's probably the biggest step of them all, is admitting that you're having issues, that you need this help. Whether it's help with your relationship, help with your daily life, help with your depression, anxiety. And an athletic trainer is someone that they felt comfortable going to open up about that. And that should be an honor. An honor of that this athlete feels like they can spread their deepest, darkest secrets to this person that they only know because of their sport. But then again, the athletic trainer is just going to send a referral. The athletic trainer is just going to send a referral to a psychiatrist or a counselor. And don't get me wrong, that's what they're supposed to do. Because technically, if you want to get there, mental health is not something that an athletic trainer is taught to treat. It's not something that they're supposed to give advice on, other than, well, we can refer you here and we'll basically keep a close eye on you. But what athlete wants to go talk to some random lady or man in a small little counselor's office that they don't know? So, I know I wouldn't pour my deepest, darkest secrets out to some person I didn't know. Sometimes it's hard to even tell them to yourself. So with the athlete taking this huge step of even coming to somebody and talking about these issues, it's kind of hard to hear that, well, okay, we're going to send you here, or we're going to throw you on medication. While medication is probably a good option for the athlete, you have to look at so many other things when it comes to that. How does the medication affect the athlete's performance? How's it going to make them feel overall? How many different medications are you going to have to go through before you find the right cocktail of things for them to put in their body to make them happy or to feel better? So what now? The athletic trainer did their job. They referred you. You go to a counselor, a psychiatrist. Well, the athletic trainer can't tell anybody. Confidentiality. They can't go tell your coach, be like, hey, take it easy on so-and-so. She's done a lot. She's going through some things right now. Peter keeps freezing. But you can't walk up to a player's friends or roommates and be like, hey, I really need you to keep an eye on so-and-so. She's going through it right now. I just really need you to keep an eye. Let me know if you see anything out of the blue. That's not something that you can do. At that point, it's between you and the athlete. And you just hope that the athletes go into meetings. They're going to get better. They're taking the time to express their feelings and emotions to the counselor, psychiatrist, whoever, and they're getting the help that they need. But what happens what if they don't? What then? Well, I would suggest that, they get the help that they need. But if not, they keep having the same issues. They fall back into the problem with all the other percentages, and out of the 10% of people who reach out for help, they go into somebody who hides behind a mask, who shows a fake smile every day, who is putting up a front so people don't know that something's wrong. Or maybe they're showing all the signs of something being wrong. Maybe they're wearing baggy clothes, they're not upkept, they have bad hygiene now versus when they did last week. They've lost a ton of weight, they're eating more, they're leaving lunch early, they're not hanging out with their peers, they're doing poorly on the field or on a court. It's things like that people don't recognize are issues that are the problem. 7.3% of NCAA deaths are from suicide. And this number is from 2015, so I can only imagine how much larger it is now. Especially since we just had another NCAA... stupid computer. Especially since there was just another NCAA athlete commit suicide 2-3 weeks ago. There's been plenty between 2015 and 2022. And this number may seem small, but it's too big for the number of students and athletes and children and grandkids and parents that we're losing because signs weren't recognized and taken care of appropriately. And you may say, well, as an athletic trainer, I did my part. I sent them away to a psychiatrist, to a counselor. That's all I can do. But it's not. You have to keep these things up. You have to keep saying, what more can I do? What do I do now? What can I do that's better? How can I help this person live a happier life, a healthier life? Well, if it's somebody with binge eating, maybe you take them, maybe your school has a nutritionist, or they have a nutrition class like UWA does. I don't know how the new teacher is, but I know when Dr. Rob was there, he spoke with athletes all the time that were having eating disorder issues. And he helped them get better. He gave them meal plans and told them what to do. And I'm pretty sure even our strength coaches help do that in terms of nutrition status. Or if it's mental health issues, you sit down, you talk with them, you keep up with them. Maybe even showing them I don't want to sit here and say show them a little extra attention, but maybe just like going out of your way to say, hey, how are you today? Or is there anything you need to talk about or anything you need to meet about and talk about in private? So I added this course on here because it's a course that I recently took in these past couple of months, and it's how to become a mental health first aider. And it's available in adult and youth, not for the youth to take, but how to address mental health in the youth. So for my sake, I took the adult course. It has pre-work. It doesn't take very long, but then it's about 8 or 9 hours of Zoom classes. And you have one instructor, and you're in there with people of all ages. You're going through it teaches you how to notice the signs, what to look for. Like I said earlier, whether somebody's losing weight, whether they're way more excited than normal, maybe they're more irritable than normal, maybe they're not performing their best. It's every little sign you could notice. And then it puts you in scenarios of, well, if you came up to this person or they came up to you or you just came into contact, maybe you didn't come into contact at all, maybe you overheard them, maybe they're a neighbor, a roommate, a friend, a sister, a brother, mom, dad, whoever, you notice that something wasn't right. Well, it teaches you how to address those problems. It teaches you how to go through and basically ask questions that maybe a normal person isn't comfortable asking. So I know one of the hardest parts of it for me was they had us practice how to ask someone if they were suicidal. And we had to keep saying it until we were confident enough to say it. And I can stand here today and I can respectively say and ask someone, are they suicidal? And feel confident about it. It's a scary thought having to ask someone that, but this course helps me do it. And it's something that I feel that all faculty and administration, athletic trainers, whoever, physicians, even some students, I feel like everyone should have a chance to take this course. It does cost money, I'm pretty sure. I have to pay for it, so I don't know how much it cost. But I feel like if it is an option for somebody, if they are able to spend the money and pay for it, then it is something that they should definitely take part in. This is becoming a giant topic in our community that needs to be addressed. So with this course, it even gives you a certificate, something to add to your resume. It's not something you should do it for, but it's definitely a big deal in helping you realize everything you can about individual mental illnesses. So just knowing the signs is the biggest thing. And it's the biggest thing with every mental health problem you can come across, whether it's binge eating, depression, anxiety, relationship problems, is knowing the signs. And some of them overlap, some of them are more specific to one or the other. It's just something that you have to know. And the biggest thing for athletic trainers, I would say, is to have an open door policy. I know at UWA, each athletic trainer has their own office, and for the most part, it's an open door policy of people just walk in whenever they want to. But just having the option to go in somewhere and talk with someone that you trust, because you have to think about it, some of these student athletes are from different countries. They're from miles and miles across the United States. They don't have their family there to confide in. Yeah, they're a phone call away, but sometimes people don't like talking on the phone. They don't like sharing these problems over the phone. A lot of people, and I've experienced this now, is that especially, so say we're at UWA and we have an athlete from Alabama. Well, Alabama has a lot of small towns, and Alabama's pretty much set in its ways on how they think and overcome things. Well, there are a lot of small towns in Alabama that see mental illness as you're crazy. Like, why would you have these issues? What have you gone through to have these problems? And I've seen that firsthand being where I'm at now, is our athletes are scared to say anything because their parents don't understand. Their parents have straight up called them crazy. They don't want anything to do with them anymore. It's a serious problem, because then you have to reach out to the student themselves and make sure that they understand that this is much more common than they think it is. It's something that is dealt with every single day by people just like them and you and me. It's something that people struggle with And it's not something to think that you're crazy for, because you're not crazy. It's something that you couldn't help, you couldn't take care of on your own. Like, you need help to get to a better place, basically. And having an open door policy with an athletic trainer is probably the best thing that you can do, because it gives them somewhere to go to confide in someone, to share their feelings, and maybe get the help that they need. And here I've just listed some of the signs and symptoms. It's definitely not all of them, but it's just so easy to find these signs and symptoms and to recognize the issues that these athletes may be going through, and basically anybody that you're around. I know at UWA it's a big issue among the athletic training students, and sometimes it's not getting handled correctly as it should be. The athletes, of course, in this slide are our main goal and focus, but you can literally get these pictures off of Google. That's where this picture's from. You can look it up. It's not that hard. It's not that hard to take the time to make someone's life better and easier and maybe a little happier.